ABFM, MSK questions and answers. With complete solutions, 100%. Correct, rated A+. Question: what is the most effective long-term treatment for chronic Achilles tendinopathy? A. AOE eccentric calf muscle strengthening exercises. Note: NSAIDs are not effective for Chronic C management. Question: a patient reports knee pain that worsens with activities like squatting, stairs, or prolonged sitting. Exam shows tenderness over the medial and lateral aspects of the knee and a positive patellar grind test. What is the most likely diagnosis? A. AOE patellofemoral pain syndrome. Incorrect diagnosis: Osgood-Schlatter disease. This causes pain near the tibial tubercle, lower on the knee, and is typically seen in adolescents. Question: what is the appropriate treatment for a stress fracture in a weight-bearing bone, e.g., tibia, in an active individual such as a runner? Weight-bearing with joint immobilization, such as a walking boot, plus reduced activity and rest. Not recommended. NSAIDs and physical therapy in the acute phase, as they may delay bone healing. X-ray equals faint lucency at this location. Toe. TX. Answers: heavy check mark, stress fracture. TX equals walker boot. Elderly patient. DEXA. Osteopenia, not osteoporosis. So she's only on CA, VIT-D. Now has fall and hip fracture. 1/3. How should her bone? Answers: heavy check mark, regard less of DEXA scan. Results: since osteopenia point now has fracture/fall. Equals: give bisphosphonate. Equals: alendronate 70 milligrams weekly. Use of bisphosphate is associated with increased risk of what? Answers: heavy check mark, femoral shaft fractures. Also, osteonecrosis of jaw, esophagitis, lateral upper thigh numbness. Toe. Answers: heavy check mark, meralgia paresthetica. Equals: impingement of lateral femoral cutaneous nerve. Equals: association with obesity, tight clothing in waist/groin. Obese kid with pain in knee. Toe. Answers: heavy check mark, slipped capital femoral epiphysis. Common: pain in anterior thigh/hip/groin, but also causes referred pain in knee. Occurs in teens and preteens. The ball at the head of the femur, thigh bone, slips off the neck of the bone in a backwards direction. This causes pain, stiffness, and instable at Y in the affected hip. 2/3. TX of slipped capital femoral epiphysis. Answers: heavy check mark, prompts surgery to stop the head of the femur from slipping any further. What supplements are needed in baby exclusively breast fed and at what age? Answers: heavy check mark, VIT-D and iron. Give VIT-D 400 ID/QD. Equals: first few days of life. Equals: give until child is getting formula milk. Equals: give iron. Equals: starting 4 months of age, but if child premature, start iron 1 month. What age should babies get cereal? Cow's milk? Answers: heavy check mark, 6 months of age equals solid. 1 year old equals cow's milk. Knee pain after prolonged sitting. Answers: heavy check mark, patellofemoral syndrome. Also knee pain with running. Hip pain, also felt in groin. Hip click, pain exacerbated with specifically internal and external rotation of hip. Equals: positive FAD IR test. Powered by TCPDF, www.tcpdf.org. 3/3.